ventilated environments. So if you are to begin with, if you're looking at control measures of this disease, and if you're looking at how to be able to prevent this disease, then everything starts from there. If you know quite well that the disease quickly spreads in crowded and poorly ventilated environments, then that brings the first step on how to control infectious coryza. Then this now brings us close to how we advise farmers who normally come to us to give them advice on how to do their housing. You find out that many poultry houses across this country, they are normally built in a manner that is not as per the requirements. You find that many farms have poultry houses. Number one, that have they have flat roofs. That is number one. Number two, if you look at the height from the ground upwards, it's not the recommended height. Some of them go to an extra mile of even using the gorofa houses, whereby some chicken are on top, others are down, and so on and so forth. So we start from there, because if you know very well that this disease quickly spreads in crowded and also poorly ventilated environments, then we begin to ask ourselves then what is the correct or the recommended poultry unit? How should the design look like? For example, we all know as a matter of common sense that we are looking at the direction of the draft air, and is normally being constructed in the east-west orientation, whereby we want to ensure that the side that faces the sun is closed, and there's the sun that does not face the side that does not face the sun is left open for the purposes of aeration. So when constructing a poultry house, the first concept is that the house should be constructed in the east-west orientation. So if you look at it in terms of now being able to enable proper air movement or proper air circulation, then we remember that normally cold air normally settles at the bottom, but hot air, because of density, it normally settles on top. So that is how we normally have air currents flowing. So the cold one will be at the bottom, the hot one will be climbing up. So when we have issues with poorly constructed poultry units, whereby we go for the flat roof, then we also don't consider the height from the ground. What will happen is that those kind of poultry units, when you get into them, the first thing that hits you is the hot air. That means that there is no proper circulation, and whereby now the hot air that basically contains a lot of ammonia is concentrated in the poultry unit. That kind of a poultry house will be very prime for this particular bacteria to really proliferate and cause a lot of damage to these poultry birds. So we normally say that when constructing a poultry unit, the best design is the east-west orientation, then followed by the roof design. And the roof design is supposed to be what we call the inverted V, or in other words, the common language is gable, so that now we have adequate space for the hot air to rise and eventually escape out of the poultry unit without any particular restriction. For example, if this was a poultry house, the way it is looking like this, you'll find out that when the hot air rises, and of course you know that the density also differs. The density of cold air, the density of hot air differs. And there's a particular height with which when we don't actually provide extra room for the hot air to go up, then it concentrates inside the poultry unit, okay? So we go for the inverted V roof, so that the hot air rises way beyond where the cold air can settle, and then with through, of course, proper air circulation, it gets out of the poultry unit. So that is where we start from. So we consider that when constructing, the third aspect is on ventilation. From the ground to about 3 feet. 3 feet should be covered by solid material. 3 feet should be covered by solid material, and then from 3 feet to about 8 feet high should be left open. And when it is left open, we cover it using chicken wire or wire mesh, so that now we aid proper aeration and proper air circulation. So when that is done, that becomes the first step towards controlling infectious coryza in poultry houses. Okay? I hope that is quite elaborate. Going to the symptoms, the common symptoms, of course, includes swelling of the face and the head. So that is very, very pathognomonic. In fact, that is what makes us realize quickly that birds are suffering from infectious coryza when we see that kind of a swelling around the face and the head. And then also there will be discharge from the eyes, discharge from the nose, and difficulty breathing. However, when we are discussing about the symptoms, at the back of our minds as practitioners, we begin to ask ourselves what the DDXs are, the differential diagnosis, because we have so many other diseases which will also present with the same clinical manifestation. So the question becomes, how do I differentiate between infectious coryza and the other diseases that have similar clinical manifestation? So when we'll be looking at the differential diagnosis, we shall be able to cover that into details. So basically, we are looking at discharge from the eyes, discharges from the nose, and also difficulty breathing. Also on the economic importance, we know that infectious coryza leads to significant economic losses for poultry farmers. Number one, that makes it quite an interesting disease is that when you are dealing with the layers, or if you are dealing with improved kienyeji that are being reared specifically for egg production, then when infectious coryza sets in, the first thing that we'll see will be a sudden drop in egg production. And this sudden drop in egg production can go as high as up to 40%. For example, if you have a laying percentage of, say, 90%, that means if you have 500 birds, 90% of 500 is how many? If you calculate, you'll be able to get that. That will tell you the number of eggs that you get from those 500 birds in one day. When infectious coryza sets in, then we'll multiply 40% of the total number of eggs that you get in a particular day. You shall see the magnitude of loss that this farmer is likely going to encounter or to incur. So when that happens, then we're going to have a significant loss of close to 40% of production of eggs in layers. And then also there'll be increased mortality. Now, when we talk about mortality rate, it basically tells us the amount or the number of birds, specifically the number of birds that are likely going to succumb when infectious coryza attacks the birds. And this mortality rate can go for up to 20%. So there's a rate between, say, 5 to 20%, but it basically depends on so many factors. One of them could be the age of the birds. Number two could also be the environmental factors. Again, it could also be the immune status of the birds. So that's why we have a range of between 5 to 20%. Now, remember, even when we're discussing about vaccination, when you vaccinate birds, it does not guarantee that those birds will not contract the disease and that they'll not die. Only that now we are trying to reduce the mortality rates. Okay? The same way when you remember, if you were to relate, when we had this disease called COVID-19, people were vaccinated, correct? And even others received up to the third jabs, the third booster vaccine. But still, they were being affected by COVID-19. So it does not mean that once you vaccinate, then the birds will not show symptoms of the disease. However, the manifestation of the clinical symptoms is greatly reduced or is greatly masked, and also, of course, the rate of mortality. Again, infectious coryza will lead to increased cost of treatment and control measures, because remember that this disease many a times, because when the birds are affected at the first instance, then remember that these birds remain carriers. So what will happen is they continue shedding the bacteria in the environment and causing more and more infections, and sometimes the rate of reinfection is also there. So you'll keep on treating birds, then after some time they respond, then the disease comes again. It flares up, many birds are affected, you treat, so it keeps on coming up. So if you look at the cost that the farmer is likely going to incur towards treating the birds against infectious coryza, is quite high. So if you're looking at economics or economies of scale in a farm, then this will become a very, very negative economic benefit that this disease is likely going to bring to the birds. So that is why we felt that it's a very, very serious disease. And you also know very, very well that very many farmers comes to you, you give them various antibiotics, and most of them are a little bit non-responsive. They're actually non-responsive towards the disease. You try this antibiotic, it doesn't work. You try this other one, it doesn't work, you know? So it really frustrates so many vets, so many practitioners, and also the farmers by extension. KDC 459U. Kindly go to the parking. Now, then introduction to infectious coryza. Like I told you that the causative agent of infectious coryza as per the initial classification, because we have the new serotyping that was recently discovered. The Haemophilus paragalinarum is a gram-negative bacteria that is the causative agent of infectious coryza, but they have, the classification is into 3 pages. 3 pages. So we have actually up to 6 pages, but as per the Kume serotyping, it was now grouped into 3 serotypes. So as per the initial classification or serotyping, infectious coryza was caused by Haemophilus paragalinarum that is in up to 6 pages. That is A, B, C, D, E, and F, based on their fatty acid profiles. But then as per the Kume serotyping, which is now the most recent, it was discovered that infectious coryza is caused by Avibacterium paragalinarum. And then based on the detection of the hemagglutinin in Avibacterium paragalinarum, there were 3 serotypes. That is serotypes A, B, and C. So you find out that A, B, and C, as per the Kume serotyping, is the one that actually causes infectious coryza. And then looking at the serovars, it was now discovered that from the serotypes A, B, and C, we have up to about 9 serovars. So for serotype A, we have serotype A1, serotype A2, serotype A3, and serotype A4. Then we have serovars B1, and we have serovar C1, serovar C2, serovar C3, and serovar C4, making it up to a complete 9 serovars as one of the causative agents that causes infectious coryzas. Now, it was also discovered as per that Kume serotyping that serovar B is a standalone, meaning that serovar A and serovar B does not offer cross protection to serovar B. Serovar B alone does not cause cross protection to serovar A and serovar C. That is why when trying to develop the vaccine, they developed a vaccine that is able to give immunity or to give cross protection against across all the serovars. Serovar A, serovar B, serovar C. And remember that those serovars, there are up to 9 of them. Okay? So on the pathogenesis, remember we were talking about Avibacterium paragalinarum. The bacterium gains entry into the respiratory tract through the nasal passages and infects the respiratory epithelium. Remember, if you are to look at the respiratory epithelium, it is lined with several epithelial cells. Then on top of the epithelial cells, there is a lot of goblet cells that are normally on lining the epithelial lining of the respiratory system. Now, when we have this bacteria, and also there's a lot of cilia, remember, there's a lot of cilia that also lines the respiratory system. So what happens is when we have infection setting in, okay, then because of that, because there's bit of, how do you call it, there's bit of irritation that will happen along the respiratory system because that is now a foreign body that has gotten into the body. So the body reacts. When the body reacts, what it does is that it forces or it causes the goblet cells to begin producing mucus. Okay? So because it depends on also the virulence, or it also depends on the magnitude or the load of the bacteria that will be getting in through the respiratory system. So the goblet cells will be producing a lot of mucus depending on the gravity of the infection. So the higher the infection, the higher the amount of mucus that will be produced. Now we're trying to understand why, like I was telling you, that the most clinical manifestation of infectious coryza is a lot of mucus discharge in the nostril area and also in the mouth. So how this mucus comes about is because of the overproduction of mucus by the goblet cells that lines the epithelia lining of the respiratory system. So as they produce a lot of mucus, then it causes clogging of the respiratory system, and this clogging is what will cause the whistling sound. The kind of kungorota na all those Swahili names, you know, zinangorota, sindio? Because basically the respiratory system is clogged with the mucus that have been produced by the goblet cells that surrounds the epithelial lining of the respiratory, where it multiplies and causes local inflammation, and that inflammation is what will cause the goblet cells to begin producing mucus as a defense mechanism for the respiratory system so that the bacteria can be flushed out. That is actually a defense mechanism. So this can result into characteristic signs of infectious coryza such as nasal discharge. That is what causes the nasal discharges, sneezing, and also eye swelling. Remember, there is a connection between the eyes and also the respiratory system. You remember that? So that is what will cause that swelling. So in severe cases, the infection can spread from the respiratory tract to other parts of the body, such as the air sacs. So if you're to do a postmortem on a bird that has infectious coryza, one of the things that you're going to pick out on, when looking at the pathological lesions will be what we call air saculitis, inflammation of the air sacs. You're going to see that very, very clearly when you do a postmortem for any bird that has symptoms of infectious coryza. Now, again, causing systemic infections and leading to decreased feed intake. So when this happens, because of course now if the air sacs are already affected, remember that this bird already is sneezing, this bird already is whistling, this bird is already having a lot of discharges, and also, of course now there is issues with respiration, or there is issue with breathing. What happens next? This bird starts not to feed well. There is decreased feed intake. So when we have this decreased feed intake, this explains why when there is infectious coryza, then the birds will reduce egg production by close to 40%. Because if we don't have adequate feed intake, and these birds need to feed so that they can be able to produce eggs, and there is insufficient feed intake, then by default, production must do what? Must go down, okay? So it is important to note that the pathogenesis of infectious coryza can be influenced by various factors, such as the virulence, which of course I described this, how or the manifestations of the clinical symptoms will be dependent on how virulent the infection is. That is number one. Number two, we'll also look at the age of the birds. Of course, the very, very young birds have low immunity. The very, very old birds have low immunity. So it depends on the age of the birds. It also depends on the immune status, okay? Vaccinated birds will have higher immunity, and therefore the manifestations of the clinical signs will be more or less masked. It will not be very open. But if the birds have not been vaccinated, that means that they have low immunity against Avibacterium paragallinarum, then the rate of infection is likely going to be higher, and therefore the rate of manifestation of clinical symptoms will be flared up. It also depends on the environmental factors, such as temperature. Of course, when we have low temperatures, then it also must, it makes the disease to even flare up. When we have very, very high temperatures, of course, it also affects it. So also we have humidity and also air quality. So that's what we're talking about. If you're to construct a poultry unit that does not have adequate ventilation, then the disease is likely going to spread faster in that particular poultry house. Now, looking at control measures, the first thing is we are talking about biosecurity. And we all know what biosecurity is. And we normally say that biosecurity is basically the first line of defense. Of course, we know that the first line of defense is normally the skin. But before you can arrive at the bird itself, we are looking at the environment. Can we control disease before it gets into the bird? So that now when it gets into the bird, before the bird develops measures, again, is trying to prevent the rate of infection, then we are first and foremost looking at the environment. We are saying that the first thing is to ensure that you are not introducing. I think this thing has some issues. It's okay, yeah? So we are saying that the first thing is that do not introduce birds from other regions or what I may call foreign birds. Do not introduce foreign birds into your flock. That is number one. Number two, we say that we try as much as possible to put in place biosecurity measures like trying to fence, of course, you are fencing your farm so that other birds that are foreign do not gain entrance into your farm. Another way of doing biosecurity, of course, is just general cleanliness. Remember that this is a bacteria that can also be transported using fomites, and fomites can be your gumboots. You're a vet. You have gone to a farm that had infectious coryza. Then you come from that farm, you go to the next farm that there was no outbreak of coryza. You become a fomite. You carry the causative agent of the disease into the next poultry farm. Then that becomes means of infection or reinfection. Again, we're talking about putting in place chemicals that can be able to help kill the bacteria. At the entrance of the farm, what we call the wheel dips, you can actually put wheel dips in your farms. We can as well also put what we call footbaths at the entrance of the poultry unit so that when you are carrying the bacteria under your feet, you're able to put it inside the footbath, and then there it will be killed, and then at least there will be no any transmission to non-infected birds. Also, we're talking about, putting on overalls. Those are the protective gear, protective clothing, so that you don't actually become a fomite and cause spread of the disease. So if we're talking about biosecurity, we're talking about all those things that helps the bacteria not to spread from infected farms to non-infected farms. But now, there's another unique finding that we discovered. And then it is just in relation to what happens on a normal occasion. For example, if somebody, remember that when we have infectious coryza, then the organ that is most likely going to be affected will be the respiratory system, correct? And I've told you that the sudden decrease in egg production is not related to the reproductive system. It is related to feed intake, low feed intake. That is why we have reduction in egg production. So there is no any relation of infectious coryza with the reproductive system. Now, because we know that if you're able to deal with the respiratory system, then in one way or the other, we are able to help in the recovery process of infectious coryza. So the question becomes how? Now remember, when somebody faints, when somebody falls down and he faints, of course, we normally have the first aid measures that are normally put in place. Of course, you make him have loose clothes. You can, unampepeta hivi so that awe na enough oxygen. Then you raise his head above the level of the body. Then from there, what do people normally do before you take him to the hospital? The easiest way of making him wake up quickly before you take him to hospital. Yo ikikataa unampeleka kwa hospitali, mtu akifaint. How do you normally handle it? You've done all those things in a fresh place, under a tree, under a shade, umemtolea nguo. So the next thing that makes him wake up very fast. Who knows? Who knows? If you get it, I'll give you a zawadi. What do you normally do? Yes? Mouth to mouth, if that fails. An irritant, that is a little bit so not friendly. What do you normally do? Yes? You try to press the lungs. That can be done, but the most effective one. Hiyo ushafanya hiyo yote. Hai? Kuna mtu anaijua hapa? Namwagia maji? No. What you do is what you do is you take either Spirit or Johnny Walker or Gilbase or what, then unaweka kwa pambo na mwekea hapa. The irritant. Well, yeah. So that is what you do and he just wakes up. Who knows the rationale about that? Who can tell me the rationale? So we are doctors, and we read. What is the rationale? It's a very, very simple thing. Don't overthink. The rationale is, see, that is alcohol. Sindio? Kama ni spirits, hiyo ni alcohol, 70% alcohol. Na pia hiyo gill base ni alcohol. Sindio? Whichever percentage it is. Ammonia. So what is the rationale? Sorry? Cooling effect. Okay, what it does is that alcohol basically opens the respiratory airway. So wakati ame faint, then there is the integrity of the respiratory system is not functioning well. There is likely going to be collapse of some of the air sacs. So when you do that, then it opens the airways, and therefore there is free flow of air, free flow of circulation of air, and that is what makes him to wake up very fast. Hiyo ikikataa ndio unampeleka wapi? Kwa hospitali. Sindio? Now the same principle, then we realized that with infectious coryza, when already the birds are infected, one of the ways of trying to ensure that the symptom, because what will actually kill the birds, close to almost 20% mortality, will be because of respiratory failure. That's what will kill the birds. Because the airways are blocked by a lot of mucus that have been produced, correct? So when we have respiratory failure, then the bird dies. So we realized that if we're able to use that same principle when someone faints with the infectious coryza, then the rate of response is very high. Are we together? So there are some very special some special chemicals that have been produced that contains alcohol. So what happens is, initially when you're talking about biosecurity measures, we're also talking about chemical control, whereby you're able to spray a chemical that has the capacity and the ability to kill viruses, bacteria, and also mycoplasma, correct? But some of them were so lethal and so strong to the point whereby you are not able to use them even in the presence of birds. You can't spray those chemicals in the presence of birds. That means that if you have 1,000 birds and there's an outbreak of infectious coryza, imagine removing layers, 1,000 of them unawatoa nje, then you go and disinfect the premises, then you bring them back. How easy is it? It's very tedious, correct? So that is what now the researchers were able to come up with a chemical that you are able to spray even in the presence of the birds. Now, this chemical will do various functions, just to help us be able to understand how to control infectious coryza. This chemical will do various functions. The first function will be, remember that this is a bacteria, Avibacterium paragallinarum. That's a bacterial disease, correct? It's a gram-negative bacteria. So remember that the birds continue to release because this bacteria continue to replicate in the respiratory system. So it's being released into the environment all the time. Okay? So as the bacteria gets into the system, it replicates. It replicates, then it is being poured into the environment, or it is being taken into the environment. Then as it is being taken to the environment, it affects more and more and more birds. When we have poor ventilation, it becomes very easy for nearly all the birds to contract the disease, correct? So what we want to do is that, because we know that these are bacteria, and it will continue to be shed into the environment more and more often, then we want to find a way of being able to kill the bacteria that is being released or being shed into the environment, so that we reduce what we call the bacterial load in the poultry unit. So that chemical targets to ensure that as the bacteria is being shed into the environment, then it kills it before it is able to affect more and more what? More and more birds. That is number one. Number two, we are targeting to ensure that, because we know that this chemical that was actually released, that was actually manufactured, it has close to 70% alcohol. So because it is safe to be sprayed even in the presence of the birds, so when spraying it, you spray it in the air like an aerosol spray. You spray it in the air, not directly on the litter of the chicken unit. You spray it in the air, for lack of a better word. You spray it aerosolly in the air, So you use a special pump that is able to release that particular fluid in form of small, tiny droplets. So as you spray it in the air, as it is dropping down, then some of the chemical will be able to interact with the litter where the bacteria is being shed, and by design, it will kill all the bacteria that is being shed in the environment. That is number one. Number two, because this chemical is coming in form of tiny droplets, some of it is being breathed by the chicken. They breathe the product. You understand? And because it contains alcohol in it, and these chicken are suffering from infectious coryza and there's blockages of the respiratory airway, as they inhale the product, which contains alcohol in it, then by default, it opens up the respiratory airways. Are we together? So what will happen is, if there was market sneezing and a lot of mucus production, then with the effect of that chemical, then there will be no longer a lot of production of the mucus, and therefore the birds will feel some sort of relief. Are we together? And we have that chemical down there by the name Biosec. So if you want to see it, you can go and have a look at it. It's called Biosec. You just spray it inside the poultry unit, even when the chicken are inside. It will do a lot of service to the poultry houses or the poultry birds when they have an infection of infectious coryza. Now, vaccination is an important tool that is now trying to look at how to control it long term. Whatever I'll talk about biosecurity will be short term. But how to control it long term is, of course, through vaccination. It's an important tool for controlling the disease. And the choice of vaccine will depend on the local epidemiology of the disease. Remember, as per the initial classification, we have up to six types. That means type A, type B, type C, type D, type E, and type F. But if you look at epidemiology, for example, in Eastern Africa and in Africa, as per the Kume serotyping, we say that now it can now be subgrouped into serovirus A, serovirus B, serovirus C, and having up to a total of 9 serovirus, then the region that we cover here, whatever is endemic, is only serovirus A, serovirus B, and serovirus C. Therefore, developing a vaccine that contains D, E, and F will be of no use, because epidemiologically, the disease is not endemic in our region. Correct? We're looking at the epidemiology of the disease. Number two, we're looking at the age of the birds. We want them to have immunity at a younger age, so that now when they reach at that age where they're now either producing eggs, and also, because remember that this disease mostly will affect the layers and the kienyeji. The broilers, they stay in the farm for a maximum of maybe 6 weeks. But these days, I know broilers can stay in the farm for even up to 4 weeks. Correct? So mostly, they'll never have issues with coryza, but the improved kienyeji and the layer birds and the kienyeji birds, they'll stay in the farm for a long time. So therefore, they'll be predisposed to this disease. Okay? So that's why that age is very, very important, and also the level of protection that is required. So it is important to consider the local epidemiology of the available control measures when developing the control strategy to minimize the impact of infectious coryza in the poultry industry. So you don't just go and take a vaccine anywhere. You need to understand how is the disease spread, or in which regions is it endemic, and of which serovar. Okay? Because we have various serovars. Now, let's look at the differential diagnosis, because I know this disease sometimes confuses even practitioners. There are some people who have ever called me many times, trying to understand, are they dealing with infectious coryza or any other disease? So we have 3 main diseases that can easily confuse you with infectious coryza. And the first one that can easily confuse you with infectious coryza is the disease by the name mycoplasmosis. And mycoplasmosis is commonly called CRD, or chronic respiratory disease, that is caused by a bacteria by the name Mycoplasma. Mycoplasma? Hey, madaktari. Okay? So that is a bacterial disease that can easily confuse you with infectious coryza. And how does it confuse you with infectious coryza? It's because it also has similar clinical manifestation of the areas around the head being swollen. Correct? But now, what differentiates infectious coryza from mycoplasmosis? You'll find that when dealing with infectious coryza, there is likely going to be what we call unilateral swelling around the head. That is number one. But then when dealing with mycoplasmosis, many at times it will be bilateral. Okay? So what we'll see is that both sides of the face is swollen. And that is what you can see here. Those who have ever dealt with this disease, you understand how it clinically presents and how it clinically it manifests. Then number two, you will find that when dealing with infectious coryza, now when you now begin doing what we call physical observation, because of course you start with general observation, then you go to physical. So in physical, you now touch the animal, correct? So as you touch, then when you press against the swollen area for infectious coryza, then likely you're going to, there's likely going to be a cheese-like exudate that comes out of the swelling or the swollen area. Cheese-like exudate, brownish in color. Okay? Brownish to whitish in color or creamish in color. So that will be absent for mycoplasmosis, because for mycoplasmosis, it is likely going to be more or less hard-like swelling. Hard-like swelling, which when you press, nothing comes out of it. So now, that is now on physical examination. Okay? So that is how to understand. But in both cases, there will be reduction in egg production. And that will be very almost instant, reduction in egg production. So both cases will result into reduction in egg production. Now, when you just wake up one fine morning and a farmer calls you that, Daktari, my layers, all of a sudden, they have reduced in egg production. That is the only clinical sign that the farmer tells you. Then you'll become confused. Then you ask him, can you send me a picture? When he sends you a picture, there is no this swelling. Which other disease comes to your mind? Which other disease comes to your mind? The only clinical sign that you're being told that, Daktari, kuku zangu zimedrop egg by almost close to 50%. Yesterday, niliokota 50 trays, now I have 25. I am worried. I didn't change any feed. I didn't change water. I didn't change any medication. I didn't do anything. They just sudden drop in egg production by close to 50%. Then as a vet, you see, you have to help. What comes to your mind? What comes to your mind? And there's no any other clinical sign. No swelling of the head, no nothing. There's no whistling, there's no nothing. Or there could be whistling as well. Or they could be sneezing as well. There's this disease by the name infectious bronchitis, correct? Now, in terms of decrease in egg production, infectious bronchitis will also manifest similar to what infectious coryza will do. But how do you rule out infectious bronchitis, especially if it is through clinical manifestation? How do you rule out before you go to pathology? How do you rule out if they are now at the layer stage, they are laying eggs? How do you rule out? Yes, at the back there. Number one is shape of the eggs. There will be deformation in the shape of the eggs. Number two, the color of the eggs. You'll find out when we have an outbreak of infectious bronchitis, then the color of the eggs will be turning towards whitish. So the pigment of the color is no longer there. The brownish pigment is no longer there. The color starts turning towards whitish. And also, if you look at also the integrity of the eggs, that means in terms of how smooth the eggshell is, you'll find out in infectious bronchitis, some of the eggs will be having a rough shell. Okay? So that is how to differentiate as to whether, based on the clinical signs that you are told, you are able to differentiate between infectious coryza and also infectious bronchitis. If the birds are not at the late stage, then you have no otherwise but to sacrifice one bird and do a postmortem. Are we together? So when we do a postmortem, if the birds are near lay, you'll see that there is significant destruction in the reproductive system for infectious bronchitis, which will be absent in infectious coryza. Are we together? So that is how to differentiate between the two diseases, the three of them, which likely can easily confuse you for the other. So already I've discussed about infectious bronchitis as one of the very important DDXs when trying to diagnose or arriving at your tentative diagnosis in cases of infectious coryza. So let us look at vaccination. And we say that vaccination is the only sure way of now being able to deal with this disease. And I think it is actually a very unique technology, because in the past we understand that most of the vaccines that have been developed in the market were targeting only viral diseases. But then of late we have been able to see that now we are able to vaccinate even against bacterial diseases. For example, we have some of the vaccines that are available in the market that are targeting to control bacterial diseases. Some of them, number one, is available in the market that there are vaccines targeting to vaccinate against bacterial diseases. Number one, what do we have? Fall typhoid, that's a bacterial disease. Number two, any other vaccine that is able to control bacteria, but is a vaccine. Which one? No, in chicken. Because the rest, for example, if you talk about Newcastle, that is a virus, correct? If you talk about Gumboro, that is a virus. If you talk about fall pox, that is a virus. But now, infectious coryza is caused by a bacteria, Avibacterium paragalinarum. So it's one of the unique technologies that are now coming up, whereby scientists are now coming up with solutions as to how we are able to vaccinate even against bacterial diseases. So if we to understand or to consider what an ideal vaccine would look like, then our target would be, we are looking at the serotypes, which I explained to you why. Because remember, we are looking at epidemiology. That is the spread of diseases. Now, because we have various serotypes and we have various serovars, if you choose the wrong serotype or the wrong serovar in a region that disease is not endemic, then you have not chosen the ideal vaccine. So you must be able to understand that in my region of operation, which are the most common serovars that becomes the causative agent of infectious coryza. So we're looking at number one, vaccine serotyping, very, very important. Number two is what we call the antigen concentration. Remember that when we are dealing with a vaccine in itself is an antigen. Then that brings us to what we call the antigen-antibody reaction. And that is how the antibodies against the disease is being built. You introduce an antigen or a disease-causing pathogen into the system, whereby there will be an antigen-antibody reaction with the one aim of being able to develop antibodies against the antigen. Correct? Now, when we have an antigen that is of lower concentration, then that means that the amount of antibodies that will be produced as a consequence of introducing the antigen will not be sufficient to be able to elicit an immune response. Are we together? So that is what makes antigen concentration quite important when coming up with an ideal vaccine. So then that takes us to even field trials. What is the antigen concentration and what is the rate of response that the antigen elicited when it was introduced into the birds? We are also looking at the route of administration, whereby we are trying to see means that can easily be used to administer the vaccine without much struggle. Are we able to get a vaccine that can be administered using more than one route of administration? Are we together? There are some people who are even in our normal clinical practice, there are some people even until today, if we tell him to locate the jugular vein, it will be a tall order. True or false? Yes. If you give him calcium borogluconate and ask him to inject in the jugular, it will be a tall order. You'll have to make some few calls, correct? So when dealing with a vaccine, also you're trying to look at various routes of administration that is comfortable, or many people or many practitioners are comfortable dealing with. Then again, we're looking at application. It should be easy to apply. Okay? Now, we are looking at a vaccine by the name Coryvac. This is one of the vaccines of its own kind that has now been introduced against infectious coryza. And like I was telling you, because a lot of research was done on this vaccine, and remember that as per the Kume serotyping, which now grouped the causative agent into 3 serotypes, serotypes A, B, and C, and each of them having up to 9 serovars. Remember that serotype A having 4 serovars, and serotype B has only 1 serovar, and serotype C has up to 4 serovars. So that vaccine contains all of them, the 9 serovars, A, B, and C serotyping, that offers full coverage and protection against infectious coryza within this epidemiological coverage. Talking about Kenya, talking about Eastern Africa, talking about Africa. Okay? So Coryvac was developed specifically targeting those serotypes that offers 100% immune coverage or immune response or protection against infectious coryza. So it's called Coryvac or Coryvac, that contains all that's available currently in the market. So we want to look at some of the studies that were conducted on this vaccine that makes it one of the unique technologies that is now coming up, targeting to control against infectious coryza. And like I was telling you initially, that one of the most important aspects that must be considered whenever you are developing any vaccine is antigen concentration. When we talk about antigen concentration, we find that each dose has not less than 10 to log 8 of colony forming units of each serovar. Now, those who are lovers of mathematics, if you are to calculate 10 to log 8, what figure do you get? Those who loved algorithms and arithmetics, if you are to calculate 10 to log 8, it is millions upon billions of colony forming units of all the 3 serovars. So that means that if you give 1 dose, that means only 1 dose. 1 dose means 1 jab per bird. So 1 jab per bird contains up to 10 to log 8 of colony forming. That is millions of colony forming units of the vaccine. So we have very high antigen concentration. Then that means that immediately it lands into the bird's body, immediately it elicits an immune response. Okay? What we call the antigen-antibody reaction. It becomes immediate. And therefore the body starts to develop antibodies against the antigen. Are we together? So very, very important to understand that Coryvac has a lot of colony forming units, and therefore it has very high antigen concentration that elicits an immediate immune response against infectious coryza. Now, the other thing is what we call the adjuvant. What I may call, in other words, the carrier molecule. Those who are lovers of pharmacology understand this. That whichever vaccine or whichever medicine that you'll be using has an adjuvant. Or in other words, it's also called an excipient. The carrier molecule that carries that drug. Remember that that molecule is being carried by something. Yeah. So what carries it is what normally makes whichever a product either bioavailable or non-bioavailable. So if you talk about bioavailability or non-bioavailability, simply we are trying to discuss how the product is effective in terms of being uptaken by the cells. Are we together? If you have to understand why there is a Panadol of 5 shillings and there's a Panadol of 1 bob. Have you ever understood why? There is a penicillin of 100 shillings and there's a penicillin of 500 shillings. Or if you understand why there's an oxytetracycline that costs you 600 bob and there's another oxytet that costs you 150. Have you ever understood why? Have you ever understood why? And you'll find out that if you are the vet who loves class and you are going for quality products, then you'll find out that in your cases, number one, the rate of response after treatment or after medication is much higher than the person who goes for the... Is it true or false? It is true. Now, the secret normally lies in the adjuvant or the excipient that makes that product bioavailable. That means it is easily available to the cells, and therefore the rate of response is quite enhanced. Now, for the Coryvac, we have unique adjuvants that makes the antigen easily available to the cells, and therefore it elicits an immediate immune response. If you have an adjuvant that holds the antigen for a longer time before releasing it to the cells, then that means that the rate of response to infection is likely going to be delayed. Are we together? Good. So, several adjuvants, including mineral oils and aluminum hydroxide, have been tested for their efficacy in enhancing the immune response with Coryvac TM antigen in chicken. And there's a special antigen that by the name montanide. And this montanide is basically an oil adjuvant that is found to be able to immune response. Use another microphone. Sorry about that. So the montanide, we have what we call an early challenge. That means that those diseases that are coming in early. Because I've seen instances whereby the disease infectious coryza is even affecting broilers. How many have seen them? Coryza in broilers. How many have seen? You're lucky this side there's no coryza. It even affects broilers because it comes early, what we call the early challenge. Are we together? And then we have the late challenge. The late challenge majorly and mainly affects only the broilers, the layers, and also the improved kienyeji and the pure kienyeji, what we call the kienyeji. Okay? So when we talk about the early challenge, then we advocate that you are able to do this vaccination as early as the 3rd or the 4th week. That means that this vaccination program or this vaccination protocol is dependent on whether this disease is endemic or not in your area of coverage. If where you are the disease is endemic, we advocate that you do an early vaccination, which can come as early as the 3rd or the 4th week. Meaning that if this disease was to affect even the broilers, then they'll be covered. But remembering that broilers, they are only in the farm for a maximum of 6 weeks. Are we together? Now, sometimes if you're only dealing with layers and improved kienyeji, then we advocate that this vaccination starts at the 5th or the 6th week. Are we together? Then, because remember that normally we would want at least the titer value of the antigen concentration to be high in the body, then we recommend a second booster. But then this second booster, we advocate that it comes in 8 weeks later. 8 to 10 weeks later. So the first early program starts as early as the 3rd or the 4th week, depending on how endemic the disease is. If you're dealing with layers and also improved kienyeji, you can start with the early vaccination regime or program as early as the 5th or the 6th week. But then you do a booster 8 to 10 weeks later. Now we have now the late challenge. So for the late challenge, we are starting the first vaccination at 8 to 12 weeks. That means that in areas where the disease is not endemic. But the farmer, maybe you're dealing with a farmer who has the parent stock. Are we together? For them, they have to do vaccination. They are not keeping the birds for the purposes of laying only, then they dispose them. Or maybe for meat only, then they dispose them. They're keeping them as parent stock. But then, the disease is not endemic in that area, but just want the birds to have titers against that particular infection. So in that regard, we advocate that you do the first vaccination at 8 to 12 weeks, and then do the second jab 8 to 10 weeks later. Are we together? So I've given you more or less 3 vaccination programs, the ones that are targeting, because this came as now another. Because when we were targeting to do the first vaccination at 5 to 6 weeks, then we were shocked that there are some birds, especially the broilers, that were also being infected with coryza as early as the 3rd week. So now someone was asking, then what do we do? Are we together? So that is why now at least we're able to do it as early as the 3rd or the 4th week, especially for the areas that the disease is endemic, and then you can repeat it 8 to 10 weeks later. But if it is normal vaccination program, the recommended initial dose or initial jab is given at 5 to 6 weeks. Then you do a repeat dose 8 to 10 weeks later. However, because like I was telling you that the antigen concentration of Corivac is so high, we have seen situations whereby even when you just give one single jab at say the 5th or the 6th week, then it offers a long-lasting immune response the entire lifetime of the birds. So it depends. If the area is quite endemic of the disease, it is so common, then you'll be advised to do a second jab or a booster vaccine. But if there is the area that you're operating on, the vaccine is not, the disease, the coryza is not endemic, then we just advocate that we just give one single jab at the 5th or the 6th week, then it offers long-lasting immunity against infectious coryza. Up to there, is it well understood? Very good. Now, we're going to look at some of the efficacy studies, because I was trying to tell you that is more or less a new concept, targeting to deal with infectious coryza, which has really become so devastating, and many a times you find out that the response to treatment is not very guaranteed. You try so many antibiotics, and you can attest to that. Is it true or false? Yeah, you try so many antibiotics, but the rate of response is so devastating, it's so demoralizing. So now the only sure way that now we're able to deal with this is through vaccination. And like I was telling you, that there were some studies that were done. You can refer to it. If anybody was to ask you that you have some data that you can refer to in terms of the vaccine, yes, there is. Because some studies were done, and these are some of the results that were from that efficacy study that was carried out on coryvac. And it was estimated that if you look at the experimental design, you can find that we had chicken that were, of course, you know how the trials are done. We have the study group, and we have the ones that are under control, correct? So the ones that are under study, they are vaccinated. Then the ones that are under control, they are not vaccinated. Then you look at the titer values, and you look at the rate of infection, and also look at the mortality. So you'll be able to look at those three things as one of the parameters that you'll be able to understand. You'll be able to explain to us as to whether it is viable or not to vaccinate against infectious coryza. Are we together? So let me just move to the graphs, because it is easier to interpret graphs than to interpret words. Let's look at the graphs. The efficacy study, if you look at this, we have two groups, group A and group B. We are looking at serover-A, and serover-A has 4 of them. Serover-B has 1, and serover-C has 4. So you're looking at all of them in totality. And if you look at serover-A, serover-B, serover-B, in terms of the efficacy studies, for the group that was vaccinated, group B. You understand that? Group B. And then also we have group C, where there was no challenge, and therefore nothing happened. So if you look at group B, in terms of efficacy, it was noted that the groups that were vaccinated, it showed high efficacy of the vaccine against the group that was under the control. So that means that the vaccine was quite effective in being able to control infectious coryza. Because remember that they are being, when you have two groups, then you expose them to the disease. Sindio? So you have one that is vaccinated and the other one that is controlled, not vaccinated. Then you expose them to the disease. Then you see the level of response in terms of being able to prevent the disease. That is all about efficacy studies. And it was realized that the group that were vaccinated, the vaccine was quite effective against being able to control infectious coryza. Are we together? Now, then also, if you look at this efficacy studies on, this first one was about re-isolation. That means that if you talk about re-isolation, are you able to pick that that bacteria after vaccination? That means if you're able to pick that bacteria, that bacteria after vaccination, then that vaccine was not effective. Sindio? If you're able to pick it after vaccination, if you're not able to pick it after vaccination, then the vaccine worked. Sindio? So that is about re-isolation. Then about mortality, about protection. Let me see if I skipped one. Sorry, I skipped one. Now, the first one on clinical signs. The ones that were vaccinated, the ones that were in blue, that is the test group. Type A, type B, type C. So group A is the test group. Group B is the control. So when they were vaccinated, it was realized that if you look at the clinical signs for the test group, you realize that there were minimal clinical manifestation. And this actually explains why I was telling you that vaccination is not a guarantee that the clinical manifestation will go away. Sindio? They can still come, but then the issue is the mortality rate still going to remain high, or it will be significantly lowered or reduced? That is the concept. So for the clinical side, it was realized that the group that were under control, when they were predisposed to infectious coryza, they manifested clinical symptoms of infectious coryza. But the ones that were under test, that were vaccinated, they showed minimal symptoms of infectious coryza. Now let's look at the mortality. So mortality, in terms of, I remember, okay, we have group A and we have group B. Group A is the test group. Group B is the control. Group A was vaccinated. Group B was not vaccinated. Then they were exposed to the disease. Correct? When they studied mortality, it was realized that the group that was under test, the test group, there was zero mortality. Are we together? But the group that was under control, where there were no they were not vaccinated, then there was a lot of mortalities. But then if you look at also serover A, B, and C, what does it tell you? That serover A is more virulent. Correct? Followed by serover C, then last is serover B. And remember that serover A and serover C does not offer cross protection against serover B. And the vice versa is true. Okay? On re-isolation, already I've discussed about re-isolation. The ones that were not vaccinated, they were able to isolate Avibacterium paragallinarum, the causative agent of infectious coryza. Then in terms of protection, sorry about that. In terms of protection against the disease, it was indicated that the Coryvac vaccine is able to offer cross protection against all the serovers. Serover A, serover B, and serover C. Are we together? Then again, you see there is maximum protection against serover B compared to serover A and serover C. But then the beautiful thing about it is that it's able to offer cross protection against all the serovers. And remember that now for our, this epidemiological zone where we are, Africa, East Africa, the ones that are endemic are the serovers A, serovers B, and serovers C, as per the Kume serotyping. So it offers cross protection against all the serovers. So we are sure that once we administer Coryvac, then we are sure of cross protection against the major serovers that causes infectious coryza. Maybe this graph can explain what I'm trying to talk about. If you look at the mean titers, what we call the titer value. Remember that when you administer a vaccine, then the vaccine elicits an immune response. Then the target is, we are looking at the antibodies against the antigen. Are we together? So the antibody is the protection against the disease. So if you were to look at this graph, it tells us the ages in weeks, and if you look at this, you can see that the one that, I don't know if it is very, very clear from there, but we have 3 lines. Able to see the 3 lines, which codes for the 3 different serovers. If you look at it, they are more or less almost the same in terms of offering immune protection. So if you look at the titer value after vaccination, you see at about 10 weeks, then we have significant significant tighter value for the vaccine. But then because you're saying that we are able to do this 8 to 10 weeks later, when you do the second booster vaccine at 8 to 10 weeks, 8 to 10 weeks later, then you offer a challenge. That means that you expose the birds to the disease. Then it was discovered that the titer value was quite so high that the birds were not able to manifest any symptom of infectious coryza. That means that now the vaccine has been able to elicit maximum immune response against the causative agent. Are we together? So that tries to explain as to why it is much advisable, especially if you are dealing with the F1 generation. That means the breeder stock. That it is advisable that you be able to do the second jab. Because by giving the second jab, then you're able to increase the tighter concentration of the antibodies in the body. Is it understood? It is clear, correct? So if you have farmers or if you have clients who have the breeder stocks, the F1 generation, then advise them that it's better for them to do the second what? Second jab or the second booster. But if you have farmers who are keeping it for about, because remember that if you're targeting layers, for example, layers should be able to stay in the farm for a period of how many months? Layers in the farm from the point of lay. The point of lay is about 4.5 months. So from 4.5 months, those birds should be staying in the poultry unit for how long? Yes? For 18 months. Anybody else? The recommended is 12 months. So from studies, it was indicated that after 12 months of lay, that means from the point of lay, so 20 months into lay, when the bird stays beyond 12 months, then the feed that they're eating, a bit of it is being converted towards weight gain. Correct? Now, because the birds are now becoming bigger in terms of their weight, if you look consequently in terms of feed intake, how do they compare? There'll be increase in feed intake. Now, when we have increase in feed intake to cater for production and also the body mass index, the weight of the body. Now, this extra feed that the chicken are consuming, and yet the production remains 1 egg every 27 hours, who is taking care of the extra feed? The farmer. So is the farmer in profit, in business or not? He's not in business. So that is why the maximum should be 12 months. Beyond 12 months, those birds will consume more than is required. If you look at the net value, you shall have made significant losses. That was quite unnecessary. Are we together? So that's why I'm saying that now if you're dealing with the layers that will only stay in the farm for 12 months post the lay period, then there is no need of doing the second jab. The same for broilers. For the kienyeji, because they can stay even up to 3 years. I can see zile zetu za huku kwetu nyumbani, they can stay there for 3 years. Me, I've seen a chicken that is very old, especially the cocks. There's a lot of inbreeding. It will breed with its children and grandchildren and great-grandchildren. The same cock. True or false? Yes, it happens. So for the kienyeji, then it is important that at least to do a second jab to boost the titer value of the vaccine. Good. So I think we are moving on well. In conclusion, Coryvac is a powerful tool to protect your flock against avian infectious coryza, thanks to its 3 serotypes, serogroups A, B, C, that provides broad spectrum protection. Coryvac vaccine contains a high antigen mass. I told you it is up to those who remember. It is what?
10 to log 8. Those who are good in arithmetic, you go and try to look at your, how do you call that book that we used to open and read the logs, the log books. So go to your log books and calculate the titer concentration, okay, and the colony forming units. Then coryza vaccine can be administered through intramuscular or subcutaneous routes, providing flexibility for your vaccination program. So if you are very, very good with breast muscle, if you're very, very good with thigh muscles, if you're very, very good with subcutaneous, then you can choose for yourself at your convenience. All of them will be able to offer protection. Then Coryvac with the adjuvant that I told you is quite safe, and it makes the antigen highly bioavailable. It helps in eliciting quick and faster immune response. So immediately you jab it, almost instantly the body starts to react to the antigen. Okay? And then Coryvac has been said to be to have very, very high efficacy in the field trials. But then there's a caution, because I've seen vets, sometimes they call us and they ask us, if you're not very, very good with the thigh muscles, there's a special nerve around the thigh area that if you look at your anatomy, you're able to locate where it is. What is the name of that nerve that is very, very delicate around the thigh area? There? The delicate sciatic nerve. So when doing this vaccination, do not go, where is it located, the sciatic nerve? If the chicken is standing on the posterior posture, the aspect. If you stand like this, where is this, maybe assuming that these are the 2 feet. So where is it located? On what aspect? On what aspect? On the medial aspect. So if you are vaccinating the chicken, do not go for the medial aspect. Okay? Very, very important to remember when doing vaccination. Go for the lateral aspect, and therefore you will not be able to hit the very, very delicate sciatic nerve. If you're not very, very careful, go for the breast muscle. Or just go for the subcutaneous around the neck area. You'll be very, very safe. And then also this vaccine, fortunately enough, there is no any post-vaccinal reaction. So that is because of the special adjuvant. Because also the adjuvant will be able to explain as to whether when you do a vaccination, there will be a post-vaccinal reaction. And even treatment, if you use poor quality product that has a very funny excipient, then when you inject it, there is likely going to be a post-treatment reaction. It happens. Even with antibiotics and even multivitamins. Yeah. So those are some of the things that we need to understand whenever you are dealing with this kind of ethicals. Until there, I would want to say thank you very much, and I would want to open this forum for any questions that I would be very, very much willing to answer. I know the question that might come is whenever already there's the disease that are set in, do you vaccinate? Let them come, those questions, I know they're coming. I would want to handle them. What do you use and all that? So I think we need another microphone for the participants. We can have another microphone for the participants so that now they can ask questions. Yes, let me give you a mic. And the regulators, I hope, have taken a good time. The regulators down there, I hope I'm in time. Okay, great.